Hello everyone, I'm Professor Byung-ho Choi at the Yonsei University in Korea. And welcome to my today Crestal Sinus Augmentation course. Today is day 2 of the course. On day 2, I'm going to talk about sinus graft material for Crestal approach technique. Have you ever wondered what is best graft material for Crestal sinus bone augmentation? This is today's topic. First, let me tell you a little bit about myself. I have been very interested in a flapless procedure in implant surgery. And I published a book about that. In 2010, I published this book, Flapless Implantology. In 2012, the book was published in French by Quintessence. I wrote in the book about flapless implant surgery and flapless Crestal sinus augmentation technique. In 2016, I wrote one chapter in the book by Dr. Torstenov about flapless Crestal sinus bone augmentation. In 2019, last year, I wrote one chapter in the book by Dr. Jeong about BMP2 in sinus bone graft. For many years, I used to perform the lateral window approach technique for sinus bone augmentation. My patient suffered from swelling, hematoma, and pain after the procedure. Sometimes the patient suffered from sinusitis after the procedure. I was very worried about the problem after the procedure. And then I tried to perform a minimally invasive lateral approach technique to decrease those sufferings for my patient. The minimal invasive lateral approach technique is using a small vertical incision, which is about 1 centimeter in length, and I made a small window, which is about 5 millimeter in diameter. And I put graft material through the small window into the sinus cavity to decrease those sufferings. You can see here a small vertical incision. Even though I made this small incision for the lateral window approach technique, the patient still suffered from swelling, pain, and hematoma. One of the problems with the technique was that when the sinus wall was thick, the technique was extremely difficult to perform. Another problem with the technique is I couldn't make sure whether the membrane was intact or perforated during the procedure. One day at night, I had a dream. In the dream, by using a small hole in the alveolar crestal area, I got this dome shape of graft material around implant in the sinus. But in reality, through the small drill hole, you can't see the sinus membrane. You can't see the bar inside the hole. Going through the small drill hole into the sinus is like a blind person working with a stick. But I tried to find a successful Crestal sinus augmentation technique. I used lots of eggs to find the Crestal approach technique. Finally, I established the Crestal approach procedure. The procedure, I presented the procedure on the previous day, on day 1. Today, let me remind you of the procedure in short. In the procedure, the first drill is a tissue punch. After tissue punch, implant osteotomy is prepared up to 1 millimeter short of the sinus floor. After that, the remaining bone is eliminated with the sinus drill. And then membrane is elevated by injecting a small amount of water into the sinus and then pulling out the water you injected to test the membrane integrity. After testing the membrane integrity, a sinus graft material is inserted into the sinus, and then an implant is placed into the sinus. after the procedure, you can get this shape of form graft material in the sinus cavity. You can get this dome shape of form formation in the sinus. Let's move on to today's topic. What is the best graft material for Crestal approach? When you look at the maxillary sinus, inside there is the sinus wall is covered with the sinus membrane. When you take a close look at the sinus membrane, the membrane is lined with millions of cilia. The cilia are moving. It sweeps out mucus. It eliminates an irritants from the sinus cavity. If you take a look at a rabbit maxillary sinus, you can see sinus air pressure. Whenever it breathes, air comes into the maxillary sinus cavity, and then it produces a sinus airflow. If there is a high-rise building in a city, the building can change airflow in the city. How about an implant in the sinus cavity? If there is an implant in the sinus cavity, like the high-rise building in the city, it can also change sinus airflow in the sinus cavity. It has been reported that implant extension into the nasal cavity can cause rhinosinusitis. The main cause of the complication is altered nasal airflow, which means that if you place an implant into nasal cavity, it can change nasal airflow and it can cause rhinosinusitis. How about an implant extension into the maxillary sinus? If the implant is extended to the sinus cavity like a high-rise building, do you think that it can cause sinusitis? I was very interested in that. And then I did animal experiment using dogs. This shows dog's maxilla. After elevating the sinus membrane, the implant was protruded 4 millimeters into the sinus. This implant was protruded 8 millimeters into the sinus. You can see here the 4 millimeter extruding implant in the sinus and the 8 millimeter protruding implant in the maxilla. We waited for 6 months to observe the change of the sinus membrane. Look at that. After 6 months, there were no signs of inflammation in the sinus cavity. The sinus membrane was intact, even though there was a high-rise building in the sinus cavity. We collected mucosal samples from the sinus mucosa. The microscopic examination showed that there was no difference between the normal side and the 4 or 8 millimeter implant side. The scanning electron microscopy also showed that there was no difference between the normal and the experimental sides in terms of ciliary orientation. The transmission electron microscopy also showed that there was no difference between the control and experimental sides in terms of the number of goblet cells. These experiments shows that the maxillary sinus mucosa is able to adapt to the changes induced by implants or graft material that are protruding into the maxillary sinus cavity. Let's move on to graft material. There are some people who argue that we don't need graft material to make a bone formation in the sinus cavity. They say that if we elevate the sinus membrane and place an implant into the sinus cavity, we can make bone formation in the sinus cavity. We don't need any graft material, they say. Do you believe that? I believe that it was true. And then I performed the procedure in my patients. You can see here, the implant was placed into the sinus cavity. And then I didn't put any graft material into the sinus cavity. Look at these x-rays before, immediately, and 2 years after the procedure. When you look at these x-rays, it seems to be true that we can make bone formation around the implant without using any graft material. But is it real? And then I did an animal experiment to confirm whether it's true or not. I used the dogs to do the experiment. After elevating the sinus membrane, an implant was placed into the sinus. I didn't put any graft material into the sinus. This is immediately after the procedure. You can see here the elevated sinus membrane. We waited for 6 months. This is 6 months after the procedure. The majority of the space collapsed. Look at the inside of the maxillary sinus cavity. The membrane collapsed onto the implant. And then you can see a very thin, pale sinus membrane covering the implant's surface. No bond between the elevated sinus membrane and implant. We collected 6 specimens from 6 dogs. You can see 6 specimens. When you look at the best specimen, best result, take a closer look at the specimen. You can see here bone formation in the space created by the elevated sinus membrane only on the buccal side. But the newborn has no direct contact with the implant. The newborn mostly did not have contact with the implant surface. The implant worked as a tent pole. Below the tent, below the sinus membrane tent, there was new bone formation. But mostly does not have a direct contact with the implant. You can use this technique in the case where 2 or 3 millimeter sinus bone augmentation is necessary, is needed. After elevating the sinus membrane, if you place an implant beneath the intact sinus membrane, you can make this type of bone formation below the sinus membrane tent. Let's move on to another graft material. Some people use blood as a graft material. They fill the space between the elevated sinus membrane and the sinus floor with venous blood. They reported that they got successful bone formation in the maxillary sinus using the venous blood. They published this report in the journal. Do you believe that? You can make bone formation using venous blood collected from the patient. I was very interested in the technique, and I did an animal experiment to confirm the result was true or not. We did an animal experiment using dogs. We collected venous blood from the dogs, and then after elevating the sinus membrane, the space was filled with the venous blood. This shows immediately after the procedure. You can see here the elevated sinus membrane and the space filled with blood. We waited for 6 months. After 6 months, the majority of the space collapsed. Look at inside the maxillary sinus. The membrane fell down onto the implant surface. We collected specimens. We compared both sides. Without blood side, with blood side. There was no difference in bone formation between without blood and with blood. We moved to another graft material, which was PRF, platelet-rich fibrin. You can collect the PRF from blood with a centrifuge. There are several reports that you can make bone formation using PRF. They argued that the PRF can maintain the space below the elevated sinus membrane and make bone formation. One of the big advantages of the PRF is you can inject PRF into the sinus cavity. I was very interested in that. And then we did an animal experiment. The space between the elevated sinus membrane and the sinus floor was filled with PRF. This is immediately after the procedure. You can see the elevated sinus membrane and the space filled with PRF. We waited for 6 months. Look at that. The majority of the space collapsed. The elevated sinus membrane fell down and it shows like a tent. collected 6 specimens from 6 dogs. Have a look at the best specimen. Take a look at this specimen. You can see here tent-shaped bone formation. Only on the buccal side, the new bone below the elevated sinus membrane mostly did not have direct contact with the implant surface. Why did it happen? I showed you a rabbit maxillary sinus. The sinus air pressure pressures the elevated sinus membrane, and it forces the elevated membrane down to the implant. And then it creates a tent-shaped bone formation. What we want is a dome-shaped bone formation rather than tent-shaped bone formation. What we want is the new bone that has a direct contact with the implant surface to make a dome-shaped bone formation in the maxillary sinus. We need to keep the membrane in the elevated position. That's why we started using BioOss Particles. This shows BioOss Particles. We did an experiment using BioOss Particles. The BioOss Particles was put into the dog's maxillary sinus cavity. And then after putting the BioOss particle into the sinus, we waited for 6 months. The BioOss particles maintained the space in the maxillary sinus. The material maintained the space around the implant. Take a look at the specimen. BioOss particles around the implant. They maintained a good shape of a graft material. They produced new bone around the BioOss particles. But the new bone mostly did not have direct contact with the implant surface. You can see here, mostly the bone did not have direct contact with the implant surface. As a result, BioOss particle graft material showed that 26% osseo integration rate, or BIC, bone to implant contact area. Only 26% of BIC. We need more than 40% BIC to do clinical functioning. That's why we added PRP to BioOss particles. BioOss particles were mixed with PRF to increase the osseo integration rate. You can see here BioOss particles mixed with PRF. We used the dogs to do experiment. On one side of the maxillary sinus, the space filled with BioOss particles alone. On the other side, the space was filled with BioOss particles mixed with PRF. And then we waited for 6 months. After 6 months, we collected specimens. You can see here, BioOss particle side show that some particles remained there. But on the BioOss particle plus PRF side, hard bone structure. Look at the specimen. When you look at the specimen, you can see more bone formation around BioOss particle plus PRF side. Look at the osseointegration rate. Higher percentage of osseointegration rate on the BioOss particle plus PRF side. Another specimen also showed the same result. Like that. And then we try to use the material for the Crestal sinus augmentation. We try to insert the material through the small hole into the sinus. Look at that. Inserting the particles through the hole. It was difficult. It was a time spending. You can see here, particles were spread, even though PRF help particles to stick together. But it was time spending. We try to inject the material into the hole. If you want to inject the material into the small hole, you should use this 1 milliliter syringe. We try to inject the material with the 1 milliliter syringe. We were not able to inject the material due to the narrow discharge orifice. Particles blocked the orifice. We couldn't inject the material. We tried to inject the material using another plastic tip. It was not possible to inject the material. And then we moved to another type of graft material, which was injectable material. We chose this injectable bone graft material. DBM gel, demineralized bone material gel. The DBM gel consists of 30% bone material and 70% collagen. It is more fluid than BioOss particle plus PRF material, as it contains fewer particles. Therefore, you can inject the material into the drill hole, small hole. And then we try to inject the material in our patient. You can see here, we injected the material with 1 milliliter syringe through the drill hole. After injecting, we found out the material went only in one direction, not in all directions. The material went upward along the slope in one direction. We couldn't get this dome shape of graft material around the implant. That's the problem with the material, with the gel type of material. And then we moved to another type of graft material, which was BioOss Collagen. This shows BioOss Collagen. It consists of 90% BioOss particles and 10% collagen. It contains a high percentage of bone material. This is a kind of a sponge. You can insert the sponge, the material, through the small hole into the sinus cavity. With the sinus graft material, BioOss Collagen sponge, we could get this dome shape of a bone formation around the implant in the maxillary sinus. And then we did an animal experiment using the material. The space between the elevated sinus membrane and the sinus floor was filled with BioOss Collagen. After putting the graft material, we waited for 2 months, not 6 months. After 2 months, we collected this specimen. Take a look at the specimen. There was good bone formation around the BioOss particles. Look at that. New bone formation around the BioOss particles. Look at the new bone formation around the implant surface. What's fascinating was that the new bone grew into the thread. And then the new bone have a direct contact with the implant surface. And then the average osseous integration rate was 45%. We tried to increase the BIC more. And then we started using BioOss Collagen plus BMP2. We added BMP2 to the BioOss Collagen sponge. The sponge was soaked with BMP2. And then we did an experiment using the material. The space in the sinus was filled with BioOss Collagen with BMP2. We waited for 2 months. Look at the specimen. We have never seen such huge bone formation around the implant, around the BioOss particles, around the implant. Look at the new bone around the implant. The new bone has a direct contact with the implant surface. That was amazing result. Let me talk more about BioOss Collagen plus BMP2. Why BioOss Collagen and BMP2 produce huge bone formation in the maxillary sinus? For bone formation to occur, need 2 elements. One is osteoblast, and the other one is extracellular matrix. The extracellular matrix works as a scaffold for cellular growth and cellular attachment. If you look at BioOss Collagen, it contains matrix. The matrix works as a scaffold for the osteoblast to attach and grow and produce new bone. If you want to make a bone with BMP2, you need a carrier for BMP2. This table shows different types of carriers for BMP2. On the top, there are different types of carriers. On the left, their properties. The collagen sponge is the best among them. Collagen sponge is the ideal carrier for BMP2. We did another animal experiment using the BioOss Collagen sponge plus BMP2. We cultured osteoblast, and then we put osteoblast and BMP2 to the BioOss Collagen sponge. And then the BioOss Collagen sponge was placed underneath the skin of the nude mouse. On one side, without BMP2. On the other side, with BMP2. And then we waited for 3 months. The graft material was not inside the bone. Underneath the skin was placed. Look at that. 3 months after the implantation. We took a micro-CT of the specimens collected from both sides. BMP2 side shows hard bone structure. Look at the specimen. The specimen shows BioOss Collagen sponge with BMP2 shows a very good bone formation around BioOss particles. You can create this bone formation underneath the skin. Another advantage, another property of BioOss Collagen sponge is elastic properties. Elastic property. The property can help elevate the sinus membrane. The elastic property can help elevate the sinus membrane in the bone defect area as well. Let me show you a healing process of BioOss Collagen sponge. When you place BioOss Collagen sponge into maxilla through the small hole in the Crestal area, immediately after placing the graft material, you can see space between the sponge and the membrane, space between the sinus wall and the sponge, between the implant and the sponge. There are lots of space, but you don't need to worry about that. Due to the sinus air pressure, the material settles down. The space will disappear. The space filled with new bone. The elevated membranes will settle down. Let me show you this case. 4 implants were planned to be placed in the maxilla. And then this is immediately after the procedure and 3 months after the procedure. This is 3 years after the procedure. You can see the healing process after the procedure. The graft material settles down. The material getting hard over time. The material getting a natural appearance after the procedure. Let's move on to our final stage. Pictures about complication. Complications that can occur during and after the procedure. The most common complication is sinus membrane perforation during the procedure. If the membrane is perforated, the saline you inject goes into the sinus cavity. The saline in the maxillary sinus will disappear quickly after the procedure without causing any problem. Usually we wait for 3 months. After 3 months, we do retry the procedure. Another complication is graft material goes into the maxillary sinus. Look at the picture. The BioOss Collagen sponge went into the maxillary sinus cavity. The doctor who performed the procedure phoned me in emergency. He asked me, what should I do in that situation? What is your recommendation for the doctor? Removing the material or waiting? I told the doctor, please wait. Look at that, 2 months after the procedure. The BioOss Collagen sponge disappeared without causing any problem. Look at another case. The case had a little bit thick sinus membrane. The BioOss Collagen was introduced into the sinus cavity. Look at that. The material went into the sinus cavity through the membrane. Waited. After 3 months, the material was gone without causing any problems. How could this have happened? If you look at BioOss Collagen, inside there are particles. The particles are like dust. Look at that. Compare 2 particles from BioOss and BioOss Collagen. The particles from BioOss looks like dust or look like a sand, but particles from BioOss sponge were like a dust. Look at the size of particles. You know, ciliary movement. The ciliary movement will remove dust from the sinus cavity. Let's move on to another complication. Implant exposure to the maxillary sinus. If an implant is exposed into the sinus cavity, like this one, do you think that it can cause sinusitis or not? We did an animal experiment to test it. Look at the CT image. The implant was exposed 2 millimeters into the maxillary sinus. This implant was exposed 4 millimeters into the maxillary sinus. This implant was exposed 8 millimeters into the maxillary sinus. We waited for 6 months. When the implant was exposed 2 millimeters into the maxillary sinus, the exposed implant surface was covered with growing enteral membrane. But when the implant was exposed more than 4 millimeters, the implant surface was not covered with the growing enteral membrane. We can expect that debris can be accumulated on the exposed implant surface if the implant surface was exposed into maxillary sinus. The enlarging debris can become a source of inflammation. Therefore, we should try to keep the membrane intact during the procedure. Let me finish off my presentation. Today, I have been talking about the best graft material for Crestal approach. We believe that the BioOss Collagen sponge is the best graft material for the Crestal approach. In terms of bone formation around implants, in terms of efficiency of inserting the material through the hole into the sinus. In addition, BioOss Collagen sponge has its own property, which is elastic property. The elastic property helps elevate the sinus membrane. Thank you so much for joining my 2-day Crestal sinus augmentation course. And I hope you enjoyed today's lecture. See you soon, and I hope you stay safe. See you soon again. Bye-bye.